All right, let's dive in. Today, we're going to crack the case on epidemiology. And trust me, it's not just about boring charts and labs. We're talking about the real life detective work that protects all of us from major health threats.
These are the exact kinds of mysteries that public health pros have to solve every single day. And the crazy thing is, the clues, they're usually hiding in plain sight, in our towns, our environment, even our daily habits. So the big question is, who are the detectives solving these massive puzzles?
You guessed it, epidemiologists. These are the investigators on the front lines. They're the ones piecing together all the evidence to figure out what these health threats are and, more importantly, how to stop them dead in their tracks. Okay, so let's get into the nitty-gritty. How exactly do these public health detectives do their jobs?
So what is epidemiology really? Well, here's a simple way to think about it. A doctor, they treat your sickness. An epidemiologist, they're trying to treat the whole community's sickness. It's all about zooming out, looking at that big picture, and finding the patterns to keep huge groups of people healthy in the first place.
Okay, every single investigation kicks off with these four basic questions. You've got who's getting sick, where's it all going down, when did this whole thing start, and of course the big one, why? Answering these questions is like sketching out the scene of the crime. It's what points our detectives in the right direction. Now, to make sense of all that chaos, every good detective needs a framework, right? A system. And for epidemiologists, they have this classic model that helps them understand pretty much any health threat out there. And here it is, the epidemiological triad. It's all about a dynamic relationship between three things. First, you have the agent. That's the what, like the virus or bacteria. Then there's the host. That's the who, the person who gets sick. And finally, the environment, the where, the conditions that let the agent and host meet. But here's the brilliant part. You don't always have to destroy the agent to stop an outbreak. If you can just break one side of this triangle, say by improving sanitation in the environment, boom, you can stop the disease right there. Of course, a detective is nothing without some hard data, right? You need numbers. So how do these folks actually measure the scale of a problem? Get this, 40 million. That's the number of people who die every year from non-communicable diseases, things like heart disease and diabetes. Numbers this huge are exactly why counting is so critical. I mean, think about it. You just can't fight what you can't measure. Putting a number on a problem is always the first step to figuring out how to solve it. So to count this stuff effectively, epidemiologists use two key measurements. First up is incidence. This tracks the new cases. It's basically the speed of the outbreak. On the other hand, you have prevalence. This measures all the cases, new and old, at one point in time. It's more like a snapshot of the total burden of the disease. Okay, so we've measured the problem. Now it's time to dig into the why. And for this part of the investigation, our detectives have a whole toolkit of different study designs they can use. And these tools basically fall into three main buckets, and each one is designed to uncover a different kind of clue. First up, we have descriptive studies. A classic example is a cross-sectional study. Just imagine taking a quick snapshot of a community at one specific moment. Now, this picture can't tell you what caused the disease, but it's the perfect way to see who's affected right now. It gives us our first solid lead. All right, once we have a lead, it's time for analytic studies to dig a little deeper. A case control study is really cool. It's like working a case backwards. You start with people who are already sick, the cases, and you compare them to a similar group of people who are healthy. Then you look back in time for both groups and ask, what was different? What was one group exposed to that the other wasn't? It's all about finding that clue in the past. But, looking backward can be tricky. Memories can be fuzzy. So another super powerful tool is the cohort study, and this one looks forward. Here you start with a group of healthy people. Some have been exposed to a potential risk, some haven't, and you just follow them over time to see who gets sick. Because you're watching it happen in real time, you know the exposure came before the disease, and that gives you much, much stronger evidence. And finally, if you really want to prove something is the cause, you need an experiment. And that's where the randomized controlled trial, or RCT, comes in. This is the absolute gold standard, because here investigators don't just sit back and watch, they actually intervene. They might randomly give one group a new vaccine and another group a placebo. This lets them isolate the effect of that one thing. It's really the most powerful way to prove that an intervention actually works. So, let's recap. We've gathered clues, we've identified suspects, we've even tested solutions, but what's the point of all this? What's the final step? Well, it's turning all that hard-earned knowledge into real-world action.
And this quote from the Institute of Medicine just nails it. It says, "Public health is what we as a society do collectively to assure the conditions for people to be healthy." See? All this detective work isn't just for some dusty academic paper. The whole goal is to use the evidence to help us, all of us, build healthier communities. And this is really where the rubber meets the road. Those clues from all those studies, they inform everything. We're talking about how to design effective vaccine campaigns, how to promote healthy eating, how to make sure we all have clean water. It all feeds into creating smart, evidence-based health policies. It teaches us to think critically and avoid bias to make sure what we're doing is actually making a difference. That is the payoff for all that hard detective work. And that's basically how the great mysteries of public health get solved. These tools are incredibly powerful, and they touch on pretty much every part of our lives. So now that you know how the detectives work, the only question left is, what public health mystery do you think we ought to solve next?